The COVID-19 pandemic, now entering its third year, had a major impact on trust in many ways. Some might say that the impact is not smaller than the events of 9/11. In this video, I will discuss things such as our trust in the media, science, and experts, the impact of virtual meetings on intimacy and trust, the impact of the polarization around masks and vaccines on trust, the quality of education and the impact it will have on trust in the future, and the Great Resignation. I'm not going to take any side on those topics, but rather discuss how they relate to, affect, or are affected by trust. Finally, I'll address the issue of the new normal. Welcome to The Trust Show. I'm Yoram Solomon, your host, the author of the Book of Trust, and facilitator of the Trust Habits Workshop. My mission is simple. I want to help you form habits that build your trustworthiness, because the answer to this question will have the biggest impact on your personal and professional success or failure. Can I trust you? Let me start with our trust in experts and the media. I remember one morning I woke up at 6:55. I was watching TV where I heard that the number of cases, COVID cases in Texas had declined 60%. Not 5 minutes later, as the local affiliate transitioned to the national program, they reported an increase of 81% in the number of COVID cases in our state, in Texas. How can they report those different numbers, minus 60% and plus 81%, within 5 minutes? I didn't touch the remote control. I didn't change the channel. Well, it would have helped understand if you listen to what they said right after that. When they said that the number of cases declined 60%, right after that, they said that the governor, Texas state governor, had decided to ban mask mandates. So saying that the number of cases went down 60% supported it. When the national station said that the number of cases in Texas went up 81%, right after that they said that people need to get vaccinated. So an increase of 81% really supports that. But could it be that it went down 60% and it went up 81%? Is one of them lying? Well, the answer is none of them was lying. If you looked at the CDC data, what you would find at that date was that over the last month, the number of cases went down 60%. Over the last week, it went up 81%. Both were right, but only both of them gave very narrow picture of what was really happening, what was supporting what they wanted to say. That was the media. But let's talk about experts. One of the things that I'm sure is going through your head is how at the beginning they said, don't use N95 masks. Then now they said, use N95 masks. Use masks, don't use masks. You need to keep a distance of 6 feet from one another. And then there was a study that showed that, actually even 6 feet is not going to be enough. Let's make it 12 feet. And then let's make it 3 feet and 9 feet. And you heard all those numbers which oddly enough are all multipliers of 3, but they keep changing their mind. Now, you know why. They're changing their minds because they don't know everything. They find new information, and that's very, very valid. However, the problem is that when they change their minds, there are two things that go through our heads that relate to trust. One is that they're not competent enough. They don't know. But the second one is even worse. They don't tell me the truth, and they don't tell me the whole truth. To be trusted, you must say, this is what I know, and I don't know everything. I am not sure. Maybe I just don't know something, and admit to that. Tell me that you're going to get the information. It's going to help me trust you more, and that's something that they were not doing. There was a study done in 2005. The title of it was Why Most Published Research Findings Are False. And it was actually a study of 49 of the most highly regarded research findings in medicine. And what it found was that the findings, when they tried to replicate it or do it with larger studies, 16% of those studies were actually contradicted. Another 16% showed a much smaller effect than initially stated, and 68% were challenged by follow-on studies. And there was a total of 49 of them, so it wasn't like 1, 2, or 3 studies. And what they said was that financial and other interests and prejudices often intervene with the study, causing the results to be less likely to be true. When you know that, how much can you trust science? If you like this video, click the like button, subscribe to this channel, and get notified when I release more videos like this. As the pandemic started, we went to a lot of virtual work, a lot of remote work, and that has a big impact on the future of work in general. But there are a couple of things that I want to reflect on in the context of intimacy and trust. It's the use of masks. If you remember, when I talked about intimacy, and I talk about that in the book of Trust, intimacy is important for us to see the consistency between what you say and what you really mean. Because what you say, you can probably control what you say, but how you say it and your body language is something that you can't control. And when they are inconsistent, we don't trust the person who tells us something. When we're wearing masks, we cover a lot of the facial muscles that allow us to see what the other person really means. So it kind of hurts that intimacy. It kind of hurts our ability to know if we can trust another person or not, or to accelerate the building of trust by seeing the other person's body language. An interesting side effect is we are having a lot more Zoom meetings, and Zoom or Teams or Google Meets and all the other methods of video conferencing. When we do that, we're not wearing masks. So you can argue that you can build trust faster or know if somebody can be trusted and whether they're consistent between their words and their body language, seeing them through Zoom without the mask, than seeing them in person with the mask on. You still can see the rest of their bodies, and so you can see their hands and you can see how consistent their body language, other than their face, is with what they're saying. And one of the behaviors that we really need to avoid if we want to be trusted is to close the camera. We need to open the cameras. We need to let the other people see us. To me, whenever I have this first conversation, and it will take place remotely because I'm about to go and speak to a client, and before I fly there to give them a keynote or a workshop, I want to first talk to them, but I want them to see my face. I want to see their faces, but I want them to see my face as well. One other issue that came out of remote working is that as a supervisor, as a leader, as a boss, you can see that your people are actually working. As a professor, as an instructor, a teacher, you can see that your students are really doing the work. And there have been a lot of tools that were developed, a lot of apps that would allow you to see if your people are doing their work, their job. If you need to see, if you need a tool to monitor whether your people are doing their jobs, you're doing two things. First is you probably have the wrong people, because you don't trust them, because this is your starting point. My starting point is I don't trust them. But the second thing that you're doing is you're actually hurting their trustworthiness. Because as I said many times, trust and trustworthiness are reciprocal. It's not only that if you behave in a trustworthy way, then I will trust you. But if I trust you and I show you that I trust you, then you will behave in a trustworthy way. If I distrust you and I show you that I distrust you, what's the point for you to behave in a trustworthy way if you already know that I don't trust you? So when you are using any of those tools to make sure that your employees are doing their work, you are telling them that you don't trust them. And when you do that, they will behave in an untrustworthy way. Self-fulfilling prophecy. Let's talk about the element of personality compatibility. Why do we wear masks? We started wearing masks really to protect ourselves. And I would challenge that. I think that the number one reason why most people would wear masks today is to protect themselves. And there was this whole argument whether these masks or those masks really protect you. And the first N95 masks that came out had these valves that would really filter everything coming into me, but really let me get everything out through that valve, one-way valve. And I think that the fact that fewer and fewer people wear masks to protect other people from themselves is hurting personality compatibility, because a big part of it, and that's a universal part of it, is how much do you care about me? And if I knew that you wear a mask because you care about me, I would trust you more. But I know that you wear the mask, number one, to protect you. This brought up really to daylight the balance between my rights and your rights. And there was a study that was done, I believe in 2017, using the World Value Survey database that showed that over the last 51 years, the level of individualism or self-centrism, or the world revolves around me, increased 12% in 78 countries. Well, you may not think that 12% is a big number, but it was 69% in English-speaking countries. So we care a lot more about ourselves than we do about other people. That's what you see with masks and with other things. There is a wide range of issues that we became very, very passionate about. Vaccines or no vaccines, vaccinations, no vaccinations, open the business versus close businesses, open schools versus close schools. What am I going to do with my kids if they have to stay at home? Do I have to stay at home? I can't work if that's what happens. Do I wear a mask? Do I not wear a mask? First of all, because we don't trust science as much as probably we should or we did, then it opened, and because of confirmation bias, it opens us a lot to believe that, I can believe one thing or the complete opposite, and I can find enough confirmation for whatever I believe in. But more than that, these are things that are very important. They're very important to us. The balance between our health, between dying, and our financial resources and abilities and our income and our ability to pay for rent, and this whole issue of, do you protect people from they don't have the ability to pay rent? How about protecting those who own the building and are paying mortgage on it, that may not be able to pay mortgage because nobody is paying rent? These are important things for us. There are two sides for each one of them, but because they're important, any differences, any ideological differences, cause us to have very different personality, or I should say personality incompatibility, very strong personality incompatibility. And that, at least in my research, I found that sharing those items have an 86% impact on trust, correlation with trust, which means that if we have very strong personality incompatibility, we would have very low levels of trust. And these personality incompatibilities and the importance, how strong and how passionate we feel about different things, manifests itself in what we see in stores, in different places, on airplanes. The FAA had just counted the number of incidents, and what they found is between 1995 and 2020, on average, there would be 120 to 150, I didn't do the exact math, incidents of unruly passengers on planes. So on average, 120. The highest was, in 2004, 310. 2021, well, 2020 was a low year, but that's because hardly anybody traveled. We didn't have vaccines, we didn't have anything, and we were still in a state of shock. But in 2021, that average of 120, 150, and by the way, it was pretty low in 2020 and 2019. In 2021, it was 1,075, more than 1,000. If you see the graph that the FAA released, you can see this huge spike because we feel personality incompatibilities and are very passionate about them. Let's talk about education, and specifically K through 12 education. I just recently heard the Texas Education Agency said that the level of our education went back 4 to 6 years. I'm not sure exactly how that happens because really the pandemic so far had been 2 years. But a study done by McKinsey suggested that in K through 12, the learning drop was such that students on average were 5 months behind in math, 4 months behind on reading. It actually, and this is at the end of every school year, so they're behind compared to what they were, or the equivalent grade levels were years ago. The pandemic actually also increased the pre-existing opportunity and achievement gaps. And what they found was that in math, students in majority black schools ended the year with 6 months behind. And with low-income schools, 7 months behind. So this is up from 5 months. So it also increases the achievement gap and the racial inequality. And not to mention that the pandemic had barely started in 2020, and then you had George Floyd and other events that just contributed to that and caused an even further political polarization. And it's more than political, it's just polarization. But so students fall behind. What are you going to do? I thought once, why not let them stay at the same grade level for one more year? Well, that would destroy higher education. Because, schools, they don't care. Fine, we got new kids coming in. We don't have kids coming out. We're going to have more students that we need to deal with, and maybe it's not that fine. But higher education, imagine they're going to miss their freshman year next year if we keep 12th graders at the same level. So what do? So higher education accepts students at a lower level than they did in previous years. What do they have to do? Lower the quality of their education. As a result, what we get is students that when they graduate, they're going to be less competent. They're going to know less, they're going to have less experience, they're going to be less competent. And we trust less competent people less. Let me talk about the Great Resignation. We know that there is a huge amount of people who are just leaving the workforce. In fact, there are more job openings than people looking for jobs. Well, in general, employment terms is getting shorter. I mean, it used to be that you would work for one place in your life, and that's where you retire or die from that one job, the only job. According to the Bureau of Labor and Statistics, the U.S. Bureau, 4 million Americans quit their jobs in July of 2021 alone. The resignation peaked in April and have remained abnormally high for the last several months, with record-breaking 10.9 million open jobs at the end of July. Now, stress plays a role here, no doubt. In some jobs, especially healthcare, frontline, stress plays a major role in people saying, I can't deal with this kind of job. Forget the specific employer. But the other thing is, employers in general, they don't get the employees involved in everything in the business, in everything that's happening in the business. And because of that, when they run into financial difficulties and they have to let employees go especially in some of the industries like the airline industry, hospitalization industry, restaurants, and other places, service places where people don't go and buy there anymore. They just let their employees go. And employees feel that their employers don't care about them as much, that there's no loyalty anymore. And guess what? It's reciprocal. If you're not loyal to me, why would I be loyal to you? And by the way, it's not necessarily even that you're not loyal to me. I see that other employers are not loyal to their employees, and therefore, generally, I don't trust employers. See, it hurts trustability. So finally, let's talk about the new normal, right? You heard that phrase a lot, the new normal. And I remember that same question after 9/11. Is there going to be a new normal? Are we going to go back to the old normal? When will we go back to normal? And the thing is, just like trust, normal is relative and dynamic. It changes. We're very adaptable people. We will adapt. We adapted to the post 9/11 way of travel and other things. We will adapt to what's happening now. Things will change. Events like this and like 9/11 tend to have a step impact, but then we catch up. 10, 20 years from now, we will not even remember what it was like before the pandemic. I don't know how long we're going to wear masks, and I don't know how vaccines are going to continue and happen. I know that every year I take a flu vaccine, and I don't have a way to know how big of an impact does it have because I don't know how many how many times I'm going to catch the flu without that vaccine. So I don't like this term, the new normal. Normal keeps changing. Normal is dynamic. Normal is relative. It will always change. Sometimes it will change faster. Sometimes it will change normal. It would change slower. I just don't think that we should be thinking in terms of a new normal and that's what it's going to be and everything is going to stay the same from that moment on because it will always continue to change. Unfortunately, with everything that I described in this episode, in this video, we will continue to have lower and lower levels of trust. And that's a shame. This is the shorter video version of the Trust Joe podcast. You can listen to the full episode anywhere you listen to your favorite podcasts.